Welcome to this course. I'm Dr. Sarah Duvall, physical therapist, and I am so excited to dive in with you and really just take a deeper look at the human body. It is such an amazing thing. So we're going to be covering lots of different information, but I guarantee that if you stick with us till the end of this course, you are going to take away something that could quite possibly be life-changing. So we're going to be diving in, looking at what should breathing look like? Should it be belly? Should it be chest? How should ribs move? What happens when people get back tightness and pain? What that looks like and how to optimize it. And then in week 2, we're going to be diving into the pelvic floor. We're going to be looking at leaking, prolapse, how to optimize the pelvic floor, what that looks like from an exercise perspective. What are some cool things that we can do to get fast results? And then we're going to be looking at diastasis. Now, I am just going to assume that you already know how to check diastasis. If not, I've got a video on that too. But we're not going to waste our time. We're going to go deep because I'm just going to assume that you're already to that level. And we're going to be looking at what can we do to help a diastasis, what kind of exercises, how can we troubleshoot what might be preventing it from healing, and then what can we do during pregnancy that might help with the prevention side from getting a severe diastasis, because everybody has one at the very end of pregnancy, but there are a few things that we can quite possibly do to help make it less severe. So I am so excited for you to join me on this journey for the human body. And so let's go ahead and dive in and get started with our first lesson. Thanks for joining me for this module on breathing. Now, I think breathing is super sexy, okay? But a lot of people are like, all right, get to the good stuff, Sarah. I want to see the pelvic floor. I want to learn more about diastasis. I don't want to talk about this breathing stuff. So I'm going to try to make it as interesting as possible using a, obviously not live model, but we're going to talk about the why behind it. I don't know about you, but I have a lot of trouble getting behind concepts where I don't understand the why. And there's so many things in women's health where there's not really a good why. We have these blanket recommendations and there's no why. All right, I'm not going to preach to the choir because I'm sure you feel the same way as me. But I think understanding the why behind breathing helps it all just click in place and helps it make sense. So let's take a look from my friendly skeleton on what's going on with our lungs and our breathing system. And you might have heard that belly breathing is good, or you might have heard that belly breathing is bad. So when you belly breathe, obviously your diaphragm comes down, belly descends. There are some good things about this, like you tap into your parasympathetic nervous system, you get your diaphragm moving, you massage your organs, you stimulate your vagus nerve. It's a good thing. But like all good things, it's a little bit too much. So what I hope to get across to you today is understanding exactly the best way to cue somebody to breathe. And the reason why we're going to spend a little bit of time talking about this is because the postpartum body, or anybody in general, even men, older women you're seeing, anybody in general, even kids, right, they need to have a proper foundation. And I'm not going to say perfect foundation because there's no such thing as perfect, right? We know that. But we need a foundation that helps set us up for more complex movements and complex processes down the road. And if you have a system where we can't pile the layers on top, then we're not going to get results and we're not going to get very far. And you're going to keep wondering, why do I keep having this, pelvic floor tightness, or why do my piriformis keep acting up with me? Why does my neck keep locking down? Why do these things keep happening? And then that usually brings me back to all those deeper layers at what's happening with the foundation. And I find breathing can be one of the biggest foundations for the body. Okay, so we have our nice model here. I really need to name him. I'm just going to go call him a him, but where I really need to name him because he's got a pretty narrow pelvis, so I'm thinking this is the guy. All right, so let's take a look at the rib cage and what's happening here. So we have our lungs underneath the rib cage. Obviously, they fill with air, all right, nice blue oxygenated air. So as the diaphragm contracts, it pulls down, helping to inflate the lungs and pull in air. So as you inhale, go ahead and inhale with me. Your diaphragm contracts, pulls in air. If it's a resting breath, so we're just sitting around reading a book, calm, chilled out, then our diaphragm is going to be the active component, and the expiration is going to be a passive component. Okay, so sometimes I'll see people and they're like ab breathers and they're over contracting their abs for everything, when we really need to work on maybe some belly breathing for someone who has a really tight abdominal system. So they get that good inhale down with their diaphragm. So their exhale can just be simply relaxation. So try that for me now. I want you to inhale down and see if you can do nothing on your exhale and just feel that exhale happen. All right, so that is the recoil of the diaphragm back to its resting position for that natural exhale. And so that's where the whole concept, I think, of belly breathing came in. So if your diaphragm pulls down, the air goes into your lungs, the pressure goes into your abdominal cavity. So diaphragm pulls down, pressure goes into your abdominal cavity. Now, what do we want to happen to that pressure when it pulls down into the abdominal cavity? That is the question I want you to ask. I always want you to ask why. Ask why for everything, and ask what, so that you actually get to the bottom of what's supposed to happen instead of just, oh yeah, let's belly breathe. All right, so as the diaphragm pulls down, if all the pressure goes into our belly, so we're imagining that now, air's coming in, pressure's going down, pressure's coming out. We're getting a lot of distension of our front fascia. All right, now, we're not gonna talk solely about postpartum women here because I feel like these concepts apply to everyone. All right, we will focus in the main course a lot on postpartum. There will be some timelines and checklists and all that good stuff and exercises that I like to use immediately postpartum. But for the most part, the course can be applied to, everybody, because it's just concepts of how the body works and moves. All right, so if we have this big belly breath, we're going to be getting a lot of give on the fascia in the front. Could this be a good thing? Maybe. It depends on the tightness of the fascia. So is their fascia very, very tight? Are their muscles very, very tight? So I have those people where they come in and they cannot relax their abs. I'm like, relax your abs. Just let them hang out. And they're like, they can't. They can't find their abs to let them relax. And for those people, you know what? Some good belly breaths might be a good idea. But for the majority of people, we don't want to have all belly breathing. Sure, we want a little bit of belly breathing, but we want to see the sides and back expand too. We want the pressure to go all the way around. Now, I've got a couple of reasons on why that's going to make really good sense, and then a few exercises in our second lecture where we can actually apply these concepts and make it easy-ish. I find introducing anything new to the body can be challenging for some people, but we can make it easy-ish. Okay, so as we look at this expansion to the sides, we've got joints in the front of the rib cage, and we have joints in the back of the rib cage. Now this is really important. So let's do a belly breath here where you don't let your rib cage move at all. So place your hands on your rib cage and inhale down without letting your rib cage move at all. If that was really hard for you and your rib cage wants to move, then good job. All right, but so when we teach that belly breathing and not letting our chest move at all, not letting our rib cage move at all, then what happens to these joints in our spine back here that are supposed to be getting movement with every breath? They become very stiff, right? And then you've got complaints of mid-back pain, mid-back tightness, because the joints in our body are supposed to move. They're supposed to move a lot throughout the day. And these little joints connecting to our spine back here are supposed to move with every breath, because when we have joints in the front and joints in the back, we get what's called a bucket handle motion for the rib cage. So as you breathe, your ribs should come out to the side because the joints in the front and the joints in the back move. All right, so what I want you to do right now is join me. Hello, Mr. Skeleton. All right, what I want you to do is right now is join me. Place your hands on your ribs and inhale. And see if you can feel a little bit push forward into your fingers, a little bit back into your thumbs, and a lot out into the notch of your hand. So inhale. Can you feel that expansion? Okay, so that is the rib cage expansion I'm going for, because as the diaphragm contracts down, our lungs fill with air, pushes our rib cage out. Now, why is that back expansion so important? Well, it's important because we want to get a little belly, we want to get a little back, but the main reason, or at least one of the main reasons, is because our psoas, which is a big giant hip flexor muscle. Now your psoas runs from the spine, from the front. All right, so your psoas runs from here, attaches to every lumbar vertebrae and disc, wraps around your leg. It does hip flexion, so it pulls up on your leg and turns your leg out, but it also does a lot of spinal stability. So it's the primary vertical stabilizer for the spine. Now we're gonna get into all kinds of fun stuff with the psoas and how we can help it loosen up, because a lot of people have tight and or weak psoas, so we're gonna be addressing that. But the thing I wanna talk about is the psoas inserts up into the diaphragm. All right, so a lot of people have complaints of back pain and tightness. Now, if we inhale into our back with every breath, then that diaphragm descends down, and where it's attached, the psoas is attached up into the diaphragm, you get a little massage. You get a little letting go, right? A little bit of release from the top. So if we're getting a little bit of letting go with every breath, it is such a beautiful system that leaves somebody feeling amazing. The other thing that it's gonna help to make happen is as you inhale down and you get a little bit of that belly breath, not a giant belly breath, we're able to keep a little bit more engagement of our abdominals. Now, we don't want to walk around with our abs really tight, but we need a little bit of engagement to allow this back diaphragm expansion to happen, so then we're not getting all this distension on the fascia in the front, and we're getting a little bit more of our sides and back. So if we have some back motion, then that means we automatically have some side motion. All right, what's on the side of our abs? Right? Our side abs. Okay, that was a bad question. All right, what's on the side? All right, our lateral abs. So we've got our lateral TAs, transverse abdominals, that deep abdominal system. And that deep abdominal system sits like my hands. So it comes in like this. So as that deep abdominal system sits like my hands and comes in, if we belly breathe, we never get any motion of those deep abdominals. We never get any eccentric loading. We never get any lengthening. We're going to get to what that does to pelvic floor strength, tightness, and diastasis later in this little series. But I want you to understand that concept. So if we don't breathe in a way that actually eccentrically loads our TAs, stretches them, gives them length, and they can be tight, and that gives you that bread loaf look, gives you distended abdominals, it can give you tightness, it can give you diastasis, it can give you pelvic floor issues. Okay, so when we get that great 360 breathing pattern carries over into everything. All right, so this is our base. Now, all right, let's back up a little bit more and let me reel myself back in and focus more on breathing here. All right, so what happens when somebody's in a shallow breathing pattern? All right, so they breathe, but the diaphragm only does a little bit of the work. It doesn't really distend down where we really feel it push out from our ribs. We're gonna go over the exercises in the next lesson, I promise. And so what happens when that doesn't happen? We get a little diaphragm expansion, but not quite as much as we should get. But we get a lot of chest and neck movement, and you're gonna see that shallow breather, where you're gonna see their shoulders wanna come up when they go to breathe. You'll see somebody set up for an exercise and they'll be like, you know what I'm talking about, like that real shoulder neck breathing. And you might be catching yourself breathing that way right now. So if our diaphragm is not doing all the work at that point, or at least most of it, because we have some little muscles that sit between the ribs as well. But if our diaphragm isn't doing the majority of the work at that point, what's doing it? Pec minor, scalenes, these breathing accessory muscles. So I want you to take a second and ask yourself, are you tight right here? Okay, do you have tightness? Do you have neck tightness? So when you overuse these accessory muscles to breathe, it's gonna cause your neck to be tight. It's gonna cause your chest to be tight. It's gonna have your shoulders wanting to pull forward. All right, you might be getting some numbness in your fingers. Let's talk about the pregnant women whose hands go numb with sleeping at night. Like, we work on this thoracic outlet area. We can, and with correct breathing, we can really decrease the amount of numbness they feel. All right, this is awesome just by changing breathing. Okay, so just to recap, this is why I love a 360 breath and kind of what it does to help the system work as a whole. Now, let's go ahead and dive in our next lesson to a couple of my favorite exercises that I'd love to share with you to help promote this healthy breathing pattern.